Welcome back. Let's continue our journey on understanding about licensing in Canada. Okay, so now on this session, I'm going to explain the difference between an assessment position, a training position, and a job position. Okay, so now we're looking at a different aspect of when you get a job or when you're practicing medicine in Canada, in what context you might be practicing. Okay. So you will see that some positions that you might apply for are considered assessment positions. That means that during the period that you will be practicing, you will be assessed and you're going to be evaluated whether or not you can continue to practice or not. The most common example is the practice ready assessments. During those 3 months where you're being assessed, they will be looking at your performance, and you will have a license that is specifically designed for that period of assessment. Okay, so that position is an assessment position. So then you have some of these the training positions. So for training positions, one of the examples that is most commonly known is residency and fellowship training. In those situations, you are under training and you will have an educational license. However, there are other training positions, such as the MLP IMG program in Manitoba or the CEDIs in Quebec, where you are being trained during a short period of time to then be able to progress either to a full license or to a full residency program. So these positions, you're still considered to be under training. Okay, so again, these are not independent practice. The ones that I talked about before, the assessment period, that's also not considered independent practice. That is usually also time limited and short, up to 12 weeks, very rarely beyond 12 weeks. The training positions really depends on the program you are enrolled. So some programs might be short, like the CEDIs in Quebec might be around 3 months. If you think about the MLP IMG in Manitoba, it's about a year. And then you have the residency programs that can go from 2 to 7 or more years. Okay, so it really depends what program you're doing. Now, remember that we are talking about clinical work. So when we talk about master's or PhD, here in Canada, master's and PhD are not clinical positions. A lot of you will be coming from countries where the residency programs have the name of a master's or a name of a PhD. So I have seen a lot of people saying, I have a master's in anesthesiology, when it was linked to their residency program. That master's of anesthesiology was not a research master's, was also not a professional master's of education or a master's of business administration. It was a master's the name they gave is a master's, but it's a residency training program. So here in Canada, and I want to simplify this, whatever you did back home that was a training towards a specialty certification, you're going to name that residency program to make it simple, okay? And anything that you did that was a master's degree that was research-based or course-based that was not linked to your clinical performance or to learning clinical activities, that one you will call master's or PhD, depending on the degree that it led to, okay? So here in Canada, master's and PhD are not considered clinical training positions. So again, I was talking about the different type of positions. We talked about assessment positions, where you have clinical situations where you're being assessed. We talked about the training positions, such as residency and fellowship. And now I'm going to talk about the job positions, where you are hired to be a staff. So you're not under training and you're not being assessed. Usually that is the goal that everybody wants. That is the ultimate goal that we would like to achieve. But usually you will have to go through an assessment or a training position before you can reach a staff position. It is common even that some staff positions or job positions will have an initial period of assessment that would be like an assessment position, and then if you pass, you then progress to your job. Sometimes you have an assessment position even before transitioning to a training position. So for example, if you start to do a residency or a fellowship program, once you come out of Canada, the first position on that province, it is common to have pre-entry assessment program, which is a period of time between 4 and 12 weeks where your performance is assessed to see if you are able to progress into the training position that you were accepted. This often happens before residency and fellowship programs. There are assessment positions, like I mentioned in the beginning, like the practice ready assessments, that lead directly to full certification. They don't lead to a training position. Now, usually with jobs, sometimes they are preceded by a period of assessment that then leads to a staff job. So for example, for a clinical assistant, it is common that you will have a period of assessment of a few weeks before you're able to go to your full staff job. If you pass that assessment, you'll have a clinical assistant license and you will be able to engage in their job as a clinical assistant on the long term, but you will then transition from an assessment position to a job position, okay? So I hope that's clear. I think it's important to understand that we have these different kinds of positions, because when I'm talking about licenses, you will see that some licenses only allow you to be assessed, some only allow you to be trained, and some allow you to practice independently. So you need to understand, depending on what position you're applying for, what's going to be the license that you also need to apply for, okay? Occasionally, the license will be the same. So for example, if you apply for a residency or a fellowship position, you will get that license as if you're doing a training already, but it will come with an evaluation period. It will come with an assessment period that you need to pass in order to continue with that license beyond the time frame of 4 to 12 weeks initial time frame. Okay, so this is really important. We will be talking, when I talk about all these other licenses and processes, it's important that you understand which kind of license you're going to get, and also for which kind of position that you're going to get. So we talked a little bit on our previous session about most responsible physician versus non-most responsible physician. And we talked about independent practice versus non-independent practice. And now you know also the difference regarding the position or the role that you will be assigned, if it is an assessment, if it is training, or if it is a staff job. Okay, so with that in mind, you will now be more suited to understand what I'm going to talk about next on our next session. See you there.